A little bit about me. I started my journey uh, as a college student, and like many college students, the dream is a simple one. Do something big. Find a cure for cancer or something like that. And so, at that time, I said the right way to do that is to not only understand medicine but also understand basic science at a much deeper level that a PhD training can allow. And one pathway I thought would be a reasonable pathway to follow is to understand structural biochemistry so that one can utilize that structural information about biomolecules to come up with the right type of molecules to inhibit different cellular processes to treat cancer, treat different diseases. And when I started my career, actually at that time, HIV was a big pandemic that had just started, and so a lot of structural biochemists at that time really focused on coming up with a new treatment option for HIV. And ultimately, it's the effort of those structural biochemists who were able to design new molecules to treat HIV as a disease. So even though the virus still is with us, but it is a much more manageable disease than it was a few decades ago. So that's really the pathway that I had chosen. But what I realized is that lab research is wonderful, but it's not the same thing as actually treating patients in person. And so that's the reason I made that transition from a biochemist to a clinical medicine doctor. And so I have been treating allergies for over 20 years now. And back in 2007, we had this one kid who came along who had 6 ER visits because of accidental exposure to nuts. And that caused anaphylactic or really severe allergic reactions, which put him in the emergency room with a life-threatening reaction. And so at that time he said, well, this is strict avoidance of those nuts isn't working out. I'm getting accidental exposure in restaurants and other places. And so we had to do something. And so we then said one way to approach it is the way we approach any allergy to any other substance. So for example, if somebody's allergic to cat or grass pollen, the way we approach it is we initially give a very small amount of that allergen and then gradually go up in the dose, and that way get the body desensitized to that allergen. So there are no real medicines involved in that. And so we said, well, we'll use the same approach in treating his nut allergies. And so he became the first person in the whole world who went through desensitization for 5 different nuts simultaneously. And 10 years later, he can eat all these nuts and he can go to any restaurant and he doesn't have to worry about having an allergic reaction to those nuts anymore. And so since then, we've treated literally thousands of people with severe food allergies. But the other part of this food allergy problem is that many people have the anaphylactic allergy, but many more have milder symptoms. They may have chronic skin rashes, they may have chronic upset stomach, pain, diarrhea, nausea, all those symptoms can be present in many people who have milder forms of food allergies. And so over time, we've developed other ways of dealing with that. So there is another technique, we call it sublingual immunotherapy, where instead of actually giving those foods in to ingest, we actually have extracts of these food that we spray in the mouth, and that way desensitize the body to whatever the person is allergic to. And so that's the approach we've come up with to treat people with milder forms of allergies which are causing chronic symptoms. And then of course, we see a lot of people with different type of immune conditions causing chronic symptoms, such as chronic, muscle pain, joint pain, fatigue. And so those are different types of immune conditions that we also treat using immune modulatory type of treatment. So I don't have time to go into all of that, but that's the kind of thing that we are currently working on. And so,
Dr. Sanjeev, that was a great exposition. So one of the things that most of the participants would like to know from you is, what are some of the preventive care techniques that they should adopt in this COVID time for food against food allergies, right? This is also, there are certain seasonalities also in terms of, people, acquiring allergy or, that getting aggravated, right? So what are some of the preventive techniques you would advise to some of our participants? That is one question. And while you answer that question, I'm requesting the participants to put some of the questions in the chat box, because one of the things that Dr. Jain believes is that, if you have kids, you should be addressing their allergy requirements much earlier, and you can solve the problem well ahead of time, and lots of sufferings is kind of eliminated, right? And there's another thing, have kids for younger children. That's a very interesting topic that I would like to request you to put in the chat box. So yeah, please go ahead on the preventive techniques, please. Yeah.
Yes. So the question has two parts. One, what to do with kids, and meaning really young kids, infants, and what to do with older kids. From an immunologist perspective, anybody who is 4 years of age is basically an adult, because they have almost the same immune system as an adult. And so a person who already has allergies to certain foods, we have no choice but to avoid those foods. So we have to first identify what those foods are, and we have to avoid them until one can get the person desensitized. And so during this time, of course, the hospitals are all very much preoccupied with the COVID-19 patients, and it's also a very good way to acquire the infection if you don't already have it. So so people are being much more cautious in what to get exposed to, so that you avoid having to go to the emergency room. The good thing about the time we're in right now is that people are not going to restaurants that often. They're eating at home mostly, and so that reduces the risk of exposure. When you know exactly what you're making at home, then the risk goes down. So that's one of the beneficial side effect of the environment we're in. Now, in terms of how to address food allergies in kids. So the kid's immune system in the first 6 months of life, and to some extent in the early age, their immune system is developing. And so very few people are born with allergies. Allergies is an acquired condition. And so the question becomes, how do people acquire allergies? And the answer to that, like with most other things, it's a very complex question. And so there is a genetic predisposition, which combined with certain exposures and the environment, especially the gut environment, the microorganisms that live in our gut and elsewhere that affect our immune system and are contributing to whether somebody develops allergy to certain foods or not. And so early in life, having exposure to all the allergenic foods has been found to be beneficial. It reduces the risk of developing allergies. So in the past, the recommendation was if you're, if you have risk of developing allergies, avoid peanut, avoid, milk and all those other highly allergenic foods. And that recommendation has changed completely. Now the recommendation is even at 6 months of age, you're supposed to introduce all these highly allergenic foods in your diet. So that's a very important thing to keep in mind. And then the second thing is the role of fiber in diet. And that's very, very important in allowing healthy bacteria to grow in your body and reduce the risk of allergies, reduce the risk of inflammatory diseases. So I want to really emphasize the role of fiber in that whole process.
Yeah, so thank you, Dr. Jain. So as we are talking, there's one question which has come into the chat box, and it says that does dairy, mostly milk related in digestion, lend to its, one sec, lots of questions coming up. So actually the chat box is moving fast. Okay, so does the dairy, mostly milk related to digestion, lend to this immunomodulatory treatment? For example, to introduce milk back in smaller portions, like 2 teaspoons a day for a week, and then 4 spoons a day, the next week, and so on. And this person who's asked the question, the person is saying that having known that the said indigestion is not a lactose intolerance issue, but a milk protein allergies issue. So that's the question.
Mm-hmm. Yes, so that's the basic idea of desensitization, that you start off with a small amount of whatever food you're allergic to and then gradually go up in the dose and then try to get the body desensitized to that. It's just that people who have really severe allergies, that approach really needs to be done under the supervision of a specialist who does that on a regular basis. Otherwise, the steps that are needed and the monitoring that's needed cannot be done very safely at home. So that's the only reason. But when I look at milk and the immune system, there are basically 3 types of reactions we have to consider. One is lactose intolerance, and that's not allergy, that's not an immune reaction, that's the body's inability to digest the milk sugar. And so that's a different problem, but that can lead to a lot of GI symptoms such as bloating or diarrhea. And then you have milk protein allergy, which then can cause the more classic allergic type of reactions. But there's also a lot of interest in the possibility of milk actually increasing the risk of autoimmunity, and that is something that is being studied quite intensely, and there does seem to be some validity to this observation that milk could increase the risk of autoimmunity in some individuals who are genetically predisposed to that.
So thank you, Dr. Jain. So the next question that we have is, I have a seasonal nasal allergy, and I get belching and gas with certain amount of gluten. Would you recommend that I take probiotics, or I do eat a lot of, eat a lot of fiber? So would you also recommend that I take some probiotics?
Yeah, probiotics, the way I look at it is the risk of taking probiotics is very low, and the potential benefit is there. So I do recommend using probiotics. The question that gets asked a lot is what type of probiotics, and unfortunately, we still don't have sufficient knowledge to be able to predict that. The way I look at the GI tract, it's almost like a rainforest in there with literally thousands and thousands of species living in symbiosis. And so by introducing a few additional species as probiotics, how will it impact the rest of them? And that's a very complex question that we're not able to predict currently. And so that's why it's worthwhile having a trial of probiotics. If it helps, great. If it doesn't, then at least you've tried it.
Here's a very short question. My husband is severely allergic to capsaicin. Any success you have had with this?
So that's something we need to investigate further. You know, capsaicin is a chemical, it's not a protein. And so protein desensitization is something that, you know, we routinely do. Chemical desensitization is a lot more challenging, but it's definitely something we can look into and see if we can treat that condition.
The other question is, do you have an opinion of milk colostrum versus vis-a-vis immune health?
Yes, so milk colostrum is very rich and very healthy overall, and so I see no harm in using that. And yeah, I would definitely recommend its use, although it's not, you know, clearly proven that it has, you know, health benefits. But again, from my understanding, I think there may very well be benefit in using colostrum.
So the other question is, our nephew has avocado allergy. Is there any remedy for that?
Yes, so we have successfully treated people with avocado allergy, and that's very treatable. And avocado allergy is a very common allergy, actually, one of the more common fruit allergies. And there is some cross-reactivity to latex and other fruits also. And so we just have to look at the overall picture and treat it. But avocado allergy is very treatable.
Great. The other one deals with corn allergy with all corn derivatives. Your take on that, Dr. Jain?
Yeah, so corn allergy is certainly not as common as wheat allergy, for example, but we have seen cases of very severe corn allergy as well, and we have treated that successfully as well.